Here is what you need to know about the opioid crisis in America today. Hi, my name is Amber Widgery, and I'm a policy specialist with NCSL's Criminal Justice Program.
And I'm Carmen Hansen, a program manager with NCSL's Health Program.
And I'm Megan McCann, policy specialist with NCSL's Children and Families Program. And here are the 5 things to know about child welfare and substance abuse. 1. In fiscal year 2014, there was approximately 415,000 children in foster care in the United States, the highest caseload since 2009. In the same year, 265,000 children entered care, the highest number since 2008. 2. The number of children under the age of 1 entering foster care is increasing, maintaining the highest percentage by age group of children entering foster care. As you can see from the past 2 slides, these demographics saw recent lows in 2011 and 2012 and have since been climbing back up. While we don't know what exactly is causing these increases, anecdotally, states feel that parental substance abuse plays a major role. 3. The number of children experiencing neonatal abstinence syndrome is on the rise. While the prevalence of these cases is focused in the Northeast Corridor, no region of the country is immune from this epidemic, and there are various pockets across the country experiencing high levels of NAS reports. 4. From 1999 to 2014, the incidence of parental alcohol or drug use as a reason for removal more than doubled. 5. State legislators have a role. A number of states introduced legislation in 2016 to address parental substance abuse, from prevention and provision of services to specialized courts, treatment programs, and reporting of drug-exposed newborns. Additionally, states can evaluate existing state statutes. For example, 47 states and territories address parental substance abuse in child protection statutes. 14 states and D.C. include prenatal drug exposure in the definition of child abuse and neglect. States can also review federal requirements and related state policies. For instance, the Child Abuse Prevention and Treatment Act, CAPTA, requires states receiving CAPTA funds to have policies and procedures for the reporting of substance-exposed newborns by healthcare personnel to Child Protection Services. Reviewing state data and bringing stakeholders together, such as the Child Welfare Agency, treatment program providers, and specialized courts, is another opportunity for state legislators.
And now, here are 5 things to know about how states are addressing this problem through the criminal justice system. 1. States have been enacting and modifying naloxone access laws. New Mexico was the first state in 2001 to broaden access to naloxone beyond the emergency room doors by allowing laypersons to possess and administer it without any legal repercussions. Today, 47 states and the District of Columbia have enacted naloxone access laws, and recent legislative action has focused on expanding access to naloxone even further. 2. States have been enacting overdose immunity or Good Samaritan laws. Generally, these laws provide immunity from criminal offenses and other legal repercussions as an inducement to encourage people to call for emergency medical assistance in the event of an overdose. New Mexico is the first state to pass a law in 2007, and now 37 states and the District of Columbia have a provision. 3. States have started to shift their focus towards creating more diversion and treatment alternatives. At least 43 states statutorily provide for pretrial diversion alternatives to the criminal justice system generally. 26 states have statutory diversion alternatives that specifically address the treatment needs of criminal defendants with substance use disorders. Additionally, there are many other diversion alternatives that have been developed by local jurisdictions without statutory involvement. 4. States have been rethinking how they penalize drug-addicted offenders. Trends have included easing mandatory minimum penalties, differentiating offenders that are drug-addicted from more serious offenders, and decreasing possession penalties while maintaining or increasing penalties for trafficking offenses. 5. States have been working to connect defendants with services and various treatment options. One of those options that has recently been addressed by lawmakers is medication-assisted treatment. Medication-assisted treatment is generally defined as the use of medication to reduce withdrawal and other addiction symptoms in combination with drug screenings, evidence-based counseling, and behavioral therapy to provide a holistic approach to the treatment of substance use disorders. States have legislatively authorized, required, or funded the use of medication-assisted treatment throughout the criminal justice system, including during pretrial release, as a part of a diversion program, in prisons and jails, and as part of a reentry program.
And now, here's what you need to know about health policy options for combating opioid abuse. A key issue for legislators concerned about the opioid issue is how to combat the abuse and misuse while protecting access for legitimate patients. Legislators have enacted patient review programs to track prescriptions and reduce the chances of misuse and abuse. Oklahoma's patient review and restriction program showed no negative effects for people with chronic conditions. In addition to counseling and behavioral therapies, medication-assisted treatment options are very successful with blocking the effects of opioids, helping a person's chances for recovery. Rapid response projects are efforts to gather and share information between emergency rooms and first responders about non-fatal overdoses. The Centers for Disease Control and Prevention funded 16 states last year to help implement and evaluate these programs. Abuse-deterrent technology formulations make products more difficult to chew, liquefy, crush, or otherwise manipulate to expedite the high from consumption. These products maintain levels for prescribing for legitimate users and reduce the ability to misuse or overdose. Incorporating prescription drug monitoring program data to electronic medical records makes it easier for prescribers to check someone's history before prescribing products. The National Association of Boards of Pharmacies Interconnect system allows each state to sign just one contract and share prescription monitoring data with over 30 other states. While methadone, a long-acting FDA-approved synthetic opioid, is only 2% of the pain prescriptions, it's the cause of more than 30% of opioid deaths. At least 5 states have recently removed methadone from their preferred drug lists. Florida created an integrative therapies pilot program for Medicaid enrollees with chronic pain. Reimbursing for treatments like acupuncture, massage therapy, and counseling reduced levels of pain for patients, increased their mental and physical function, and reduced overall costs. Many providers treat chronic pain without specific training. Oregon developed an online training module for providers about treating pain. At least 4 states recently developed media campaigns to educate the public about prescription drug abuse. An evaluation of Utah's Use Only as Directed campaign found that 34% of Utahns said the campaign made them a great deal more aware of prescription drug abuse, and 52% said the campaign made them less likely to share painkillers. Making a note in someone's electronic medical record or the prescription monitoring program that they have had a problem with misusing opioid products may inform a provider or pharmacist to refrain from prescribing those products. Legislators and other policymakers are actively addressing this problem, making it one of the top issues of recent legislative sessions.
This is an important and perennial issue in the states, and lawmakers will continue to take action. If you have questions, please visit our webpage at ncsl.org or contact one of us.